Today we will discuss with you on social determinants of health. In our classroom, we have broadly discussed about what do you mean by health, where I have already said that health is not only a biological condition, it is the lots of socio-cultural and socio-economic and socio-political factors plays a major role in determining a condition of a health of a person. Today, I will discuss on what are the social determinants that health is related with. So it is divided into two levels, that is individual level and population level. All the family structure, family, kinship, and all are also related with the health structures. Already, many migrant studies have it was found that if it is in high income countries also like America, we have seen especially the migrant people are too much. It is very much. They have lots of health risks rather than the other native people. So their life expectancy of the migrant populations are very much lower than that of the native people of America. So if you can see that income and lots of determinants, income is one of the major factor. But first of all, individual level, it will be discussed. Means it is very important that who they are and what they do. Actually, means the age, the sex, the gender is related to health. And another health behaviors of the individuals, as for example, smoking, physical activity, the consumption of alcohol, the dietary pattern also influence a lot in the health of a person. So there are other some social variants. It is the individual level. These are the variants that are very much related to the individual level. But there are other conditions that can be termed as the social determinants of health, is also very much related in determining the health of a some particular person or a group. That is the condition where they born, where they grow, where they live, and where they work, and their age, means their social economic network, their culture, the environmental condition, the health system also influence a lot in the health of a person. So now, if you can see the social determinants, so now it is very much related with the money, the power, the relations, their health policies of countries within the country, outside of the country, are very much related with the social. What I just wanted, it is included in the social variance, and it influences the social determinants of a means a group or an individual, especially in a group of a health of a group or an individual. So who has divided two systematic determinants. One is called structural determinants, and other is called the socio-economic position, that is intermediate determinants. One is structural determinants and other is intermediate determinants. That what are the structural determinants? One is the socio-economic and socio-political context of a person, that does governance, the policies, the values, and it is also related with the in structural determinants. It is also related with the socio-economic position, as per example, education, occupation, gender, ethnicity, income, social class, all are comes under the structural determinants. Now, what are the intermediate determinants? Structural determinants actually are means it is influenced by the intermediate determinants, that is the material circumstances, the house pattern, their standard of living, as for example, psychological factors, behaviors, biological factors, and especially the education. Now, if we can discuss on the income, if we can describe descriptively the income of a health of a person, how income is related to the health. Now you can see that income is strongly associated with the morbidity or mortality of a group of a person. Some income influences the health and longevity of a through various clinical, behavioral, social, and environmental mechanism. And poor health also contributes to reduce the income. It is vice versa. Poor health always decides or always contributes in the reduction of income and creating negative feedback loop, sometimes refer to the to as the healthy poverty trap. And other way, in other words, we can see the income can increase the standard of a health, or the standard of the longevity of a person, a standard of living standard of a person. So it is vice versa in terms of, if you can see in education also, if it is very much it is also very linear. Sometimes it is not a very static kind of thing. Education influence means health influence education. As for example, we can say that if a healthy person uh, if it is he or she had some kind of health disparities in their childhood, there is a lots of barriers to attain a good education. Under means in other ways, if you can see that a person does not have the education, proper education, so most of the time they are failed to understand most of the health vulnerabilities or the seriousness of the health, and that way means they are not being able to avail again the health benefits are in the. Now we can see that most especially in India, people, though there are lots of health facilities, most of the time people are not being able to access this kind of health facilities. Why? Number one, first of all, they don't have the proper education, proper understanding. Most of the time, if you go to the survey, you will find that most of the people, most of the especially means they have who have the less education, who have the less income, first of all, they don't want to understand the importance of health policies. They don't have the awareness on the health policies. So that is why if they have a lower income group people, they are not being able to avail this kind of health facilities due to many factors. Other factors, as for example communication, as for example lack of money, whatever it is, they are not being an education also. Again, I have said that it plays a major role. If they don't have the awareness level is also much later. Most of the time they ignore their diseases, they ignore their, especially in terms of, if you can see the health and hygiene, especially in uneducated low income people are more prone to some kind of disease, contaminated disease, due to lack of health and hygiene. So these are very much interlinked. And now if you can see, if you can see the income, on it is also very much related with the national and international policies. If you can see these times of COVID pandemic, you have see how the whole income of the world, including our country, is in threat due to the health disparities, due to this pandemic. And it has really influenced the income status of the whole world. decreased. The now GDP has come means it has been decreased, and you can see that what is the status of the means income of our whole world or in the country due to the pandemic. So you can see that how one health disparities have been means it has completely making hazards of whole economy of the world. So it is the suffered, people are suffering in the individual level, people are suffering in a social level, and in that way, both the determinants, that these determinants, social determinants as income, educations, are very much interlinked with each other. So let's see in the next class we will discuss means descriptively on these topics. But I just want to say that poverty is long been recognized as a contributor to disease, obviously to the disease and death. And several recent trends have generated an increased focus link between income and health. So first, in income inequality, if you can see in United States, has increased dramatically in recent decades, while health indicators has plateaued and the life expectancy differences by income have grown. So there is a growing scholarly and public recognition that many non-clinical factors, education, employment, race, geography, influence the health outcomes. And healthcare payment and delivery system reports have encouraged the emphasis on addressing the social determinants of health, including income. So now we cannot, just I want to mean that we cannot uh, simply discuss health in it as a biological condition. So income inequality is increasing, linked with the disparities already have life expectancy across the income distribution, and these disparities seems to be growing over time. So in 1970s, 60-year-old man in the top half of the income distribution could expect the life of 1.2 year longer than a man in the bottom half. So by the turn of this century, it could be expected to live 5.8 years longer. So, some of the study by Ras Sethi and colleagues found that in 2001, life expectancy has increased to 2.5 years for the top 5% of income distribution, but there have been no gains for those in the bottom 5% income. Who have who had a lesser income, that does not have, there is a no increase of life expectancy. So a man in top 1% of income distribution can now expect to live 15 years longer than those in bottom 1%. So for women, the difference about 10 years, and effect equivalent to the lifetime of smoking. So whatever it is, so we can see there, if there is an income, the life expectancy will surely be built. So surely be increased. So there are many factors also related to income, that the clinical factors, the behavioral and environmental factors. So we can see the policy approach, a multifaceted policy approach. So these are also very much interlinked with the income of a country. So now if you can see education, same. If you can, many studies it has been seen that if you have a higher level of education, then the life expectancy is much better than the lower level of education, which I have already discussed a little bit. So students, so it is very much necessary to understand the health status of a person, especially with the social variance, socio-economic, socio-cultural variance. Thank you.